Good morning. This is Dr. Adel Bondok, Professor of Anatomy and Neuroscience, Mansoura University, Egypt. Today I will talk about the anatomy of the tongue. Okay, regarding the structure of the tongue is formed of a sac of mucous membrane filled with muscles. So mucous membrane and the muscles. The tongue is divided into two parts. Part in the oral cavity and the part in the pharynx. So oral part and the pharyngeal part. The oral part is anterior 2/3. The pharyngeal part is the posterior 1/3. Regarding the muscles of the tongue, they are 8 muscles. They are arranged into 4 extrinsic muscles and 4 intrinsic muscles. Regarding the blood supply, it is supplied by lingual artery and lingual vein, and then we'll talk about the motor and sensory nerve supply and the lymph drainage of the tongue. Start by the mucous membrane of the tongue. This is the mucous membrane. The mucous membrane, this is the dorsum of the tongue. This is the dorsal surface. It is divided by this sulcus terminalis, into anterior 2/3 and the posterior 1/3. So the mucous membrane of the dorsal surface of the tongue is divided into anterior 2/3 and the posterior 1/3. This is the oral part and this is the pharyngeal part. Regarding the anterior 2/3 of the tongue, it is rough. It is rough due to the presence of lingual papillae, and we have 4 types of lingual papillae. The first one is the vellate or circumvallate papillae, and these vellate papillae are present along sulcus terminalis, then filiform papillae, and defoliate papillae, and the fungiform papillae. These papillae contain the receptors for taste, which are called taste buds. Regarding the posterior 1/3, the posterior 1/3 is smooth due to absence of lingual papillae. Then let us compare between the oral and the pharyngeal part of the tongue. Let us compare between the anterior 2/3 and the posterior 1/3 of the tongue. Okay, regarding the oral part, it is the anterior 2/3. Pharyngeal part, it is the posterior 1/3. The oral part is present in the oral cavity. The pharyngeal part is present in the oropharynx. The oral part, the mucous membrane of the oral part is rough due to the presence of lingual papillae. The mucous membrane of the pharyngeal part is smooth due to absence of papillae. Regarding lymphoid follicles, lymphoid follicles are absent in the oral part. The pharyngeal part contains lymphoid follicles. These lymphoid follicles are called lingual tonsil. That's why the dorsal surface of the posterior 1/3 is nodular, although it is smooth. Regarding the nerve supply, the oral part is supplied by the lingual nerve and the chorda tympani branch of the facial nerve. The pharyngeal part is supplied by the glossopharyngeal nerve. Regarding the development of the mucous membrane, the oral part is derived or develops from the first pharyngeal arch. The pharyngeal part is developed from the 3rd pharyngeal arch. That's why the anterior 2/3 or the oral part is supplied by the lingual nerve, and the posterior 1/3 is supplied by the glossopharyngeal nerve. Regarding the arterial supply, the tongue is supplied by branches of the lingual artery. The oral part is supplied by the deep lingual artery. The pharyngeal part is supplied by the dorsal lingual arteries. Regarding the ventral surface of the tongue, this is the ventral surface of the tongue. Then we have 2 features, midline and on each side. So in the midline and on each side of the midline. In the midline, this frenulum, this is the frenulum of the tongue. It is a fold of mucous membrane called the frenulum. On each side of the frenulum, I can see vein, artery, and nerve. So this is the deep lingual vein, deep lingual artery, and the lingual nerve. Then this fold of mucous membrane, it is called the fimbriated fold. Then this elevation, This elevation is called the sublingual fold, and this sublingual fold is formed by the sublingual gland and the openings of the sublingual ducts. Then we have another opening here on each side of the frenulum. This is the opening of the submandibular gland. Again, this is the ventral surface of the tongue. In the midline, okay, this is the frenulum of the tongue in the midline. On each side of the midline, okay, we have three structures: vein, artery, and nerve. Okay, so this is the deep lingual vein, this is the deep lingual artery, and this is the lingual nerve. Then fimbriated fold, this one, this is the fimbriated fold, and then the sublingual fold formed by the sublingual salivary gland and the openings of the sublingual ducts, and then this opening on each side of the frenulum, which is the opening of the submandibular duct. Regarding the muscles of the tongue, we have muscles outside the tongue and the muscles inside the tongue, extrinsic muscles and the intrinsic muscles. So overall we have 8 muscles, 4 extrinsic and 4 intrinsic. Regarding the extrinsic muscles, we have this one. This is the genioglossus muscle, and this genioglossus is for protrusion of the tongue. The other one, this one, coming from the styloid process, this is the styloglossus. It is for retraction of the tongue. Then this muscle coming from the hyoid bone, this is the hyoglossus for depression of the tongue. And this one coming from the palate, palatoglossus, it is for elevation of the tongue. So 4 muscles: genioglossus, styloglossus, hyoglossus, and palatoglossus. Regarding the intrinsic muscles, which are present inside the tongue, they run in 4 directions. The first one, longitudinal, superior and inferior, and vertical, and horizontal or transverse, and oblique. Okay, they are responsible for changing the shape of the tongue. So the extrinsic muscles again, we have 4 extrinsic muscles. This is the first one, genioglossus muscle. It arises from the superior genial tubercle inserted into the tongue. This is the second one, styloglossus muscle. Arises from the styloid process inserted into the tongue. And this one, hyoglossus muscle, it arises from the hyoid bone and it is inserted between the styloglossus and the genioglossus. Okay? And the number 4 is palatoglossus muscle, arises from the palatine aponeurosis and is inserted into the tongue. The 4 muscles, the 4 extrinsic muscles, plus the 4 intrinsic muscles, all of them are supplied by the hypoglossal nerve, except the palatoglossus muscle, which is supplied by the pharyngeal branch of the vagus. Okay? This muscle is a key muscle in the submandibular region, the hyoglossus muscle. So we should be aware of the relations of the hyoglossus muscles. The hyoglossus muscle has 5 superficial relations and 5 deep relations. Regarding the superficial relations, from above downward, the first one, this muscle, styloglossus muscle. Second one, a nerve and ganglion. This is the lingual nerve and submandibular ganglion. Then the deep part of the submandibular gland and the submandibular duct. Then another nerve, hypoglossal nerve, and then a branch from the lingual artery is called the suprahyoid artery. So the 5 superficial relations of the hyoglossus are from above downward, styloglossus muscle, lingual nerve and the submandibular ganglion, deep part of the submandibular gland and the submandibular duct, and then hypoglossal nerve and the suprahyoid artery. These structures are covered by the mylohyoid muscles. Okay, so actually these structures are the deep relations of the mylohyoid muscle. Then regarding the deep relation of the hyoglossus, this is the hyoglossus muscle, this is the geniohyoid muscle. So regarding the 5 relations, 5 structures which lie deep to the Hyoglossus, 4 from behind and 1 from the anterior side. Okay, the 4 structures coming from behind: ligament, muscle, nerve, and artery. Regarding the ligament, this is the stylohyoid ligament from the styloid process to the lesser horn of the hyoid bone. Then muscle, stylopharyngeus muscle. Then nerve, the glossopharyngeal nerve. Then artery, the second part of the lingual artery. This is the lingual artery. This is the first part behind, second part deep, third part in front. And one muscle coming from front, which is the genioglossus muscle. Regarding the action of the genioglossus muscle, genioglossus protrudes the tongue and deviates the tongue to the opposite side. So the left genioglossus, the action of the left genioglossus is protrusion of the tongue and the deviation of the tongue to the right side. Regarding the lingual artery, this is the external carotid artery, and this is the hyoglossus muscle. This is the genioglossus, and this is the geniohyoid, and this is the sublingual gland. So the lingual artery, regarding the origin of the lingual artery, it is a branch of the external carotid artery. It terminates inside the tongue as the deep lingual artery. The course, it is divided by the hyoglossus into 3 parts. The first part behind the hyoglossus. The second part lies deep to the hyoglossus. The third part lies in front of the hyoglossus muscle. Regarding the branches, the first part gives one branch. It's called the suprahyoid artery. Second part gives 2 branches, 2 arteries, 2 dorsal lingual arteries. The third part gives 2 branches, one to the sublingual gland, it's called the sublingual artery, and it continues as the deep artery of the tongue, which supplies the anterior 2/3 of the tongue. So the lingual artery is a branch from the external carotid artery. It terminates as the deep artery of the tongue. It is divided by the hyoglossus into 3 parts. First part behind, second part deep, third part in front. Regarding the branches, first part gives the suprahyoid artery, second part gives the dorsal lingual arteries, third part gives the sublingual artery to the sublingual gland, and deep lingual artery to the anterior 2/3 of the tongue. Regarding the nerve supply of the tongue, there is motor nerve supply and the sensory nerve supply. Regarding the motor nerve supply, all the intrinsic and the extrinsic muscles of the tongue are supplied by the hypoglossal nerve, except one muscle, which is the palatoglossus muscle, which is supplied by the pharyngeal branch of the vagus. So the motor nerve supply of the tongue, hypoglossal nerve, except palatoglossus muscle. Regarding the sensory nerve supply, we'll divide the tongue into anterior 2/3, posterior 1/3, and the most posterior part of the tongue. The anterior 2/3 of the tongue supplied by lingual nerve for general sensation and the chorda tympani branch of the facial nerve for taste sensation. Regarding the posterior 1/3, it is supplied by the glossopharyngeal nerve, general sensation and the taste sensation. Regarding the most posterior part of the tongue, it is supplied by the internal laryngeal branch of the vagus. So regarding taste sensation from the tongue, taste sensation, the anterior 2/3 of the tongue are supplied by the facial nerve, which branch? Chorda tympani branch. The posterior 1/3 is supplied by the glossopharyngeal nerve, the lingual branch of the glossopharyngeal nerve. Regarding the most posterior part of the tongue and the epiglottis, supplied by the anterior laryngeal nerve or internal laryngeal branch of the vagus. So the anterior 2/3, regarding the taste sensation, taste. Anterior 2/3, facial nerve, chorda tympani. Posterior 1/3, glossopharyngeal nerve, the lingual branch. Posterior 1/3, most posterior part of the tongue, it is the vagus nerve, the internal laryngeal branch. And finally, lymph drainage of the tongue. The tongue is divided into tip, anterior 2/3, and the posterior 1/3. The tip of the tongue drains into the submental lymph nodes. Anterior 2/3 of the tongue drain into the submandibular lymph nodes. The central part of the tongue drains bilaterally to the two submandibular lymph nodes of the two sides. The peripheral part of the tongue drains unilaterally to the ipsilateral submandibular lymph nodes. Regarding the posterior third of the tongue, it drains into the upper deep cervical lymph nodes, which are called jugulo-digastric lymph nodes. So lymph drainage of the tongue, tip of the tongue, submental lymph nodes, anterior 2/3 submandibular lymph nodes, posterior 1/3 upper deep cervical lymph nodes. Actually, the submental lymph nodes drain into the submental lymph nodes drain into the submandibular lymph nodes, and the submandibular lymph nodes drain into the upper deep cervical lymph nodes. And thank you very much. Best wishes and good luck.